Hi, everyone, and welcome to today's Heal Connection sharing session, Communicating for Impact, Getting Your Research in the Media. I'm Natalie Visuete, one of your moderators for today's session and a member of the Heal Connections team. Today, you will be hearing from Carl Bates, Executive Director of Research Communications at Duke University, Rose Hoban, the founder and editor of NC Health News, Kate Nicholson, the founder and executive director of the National Pain Advocacy Center, and my fellow moderator from Heal Connections and a professor at the University of North Texas, Scott Walters. As you listen to today's presentation, please feel free to use the chat to add questions. Around 2 o'clock, we'll have an opportunity for Q&A and peer-to-peer connection. Today's agenda will start with Scott, who will provide an overview of Heal Connections and talk about his experience as a researcher, sharing his findings with the media. Then we'll hear from Carl, who will discuss working with your institution's media relations office. Rose will discuss working with the media, and Kate will share tips from a patient and community partner perspective. Our learning objectives for today include understanding why and when media exposure can be important, what makes for a good story and what journalists are seeking, how to partner with your university and institute communicators when working with the media, and how to hone your elevator pitch and talking points that will resonate with the media. We also wanted to note that there is some gray area between relaying your research results to journalists and getting into more advocacy territory. For NIH-funded researchers, we just wanted to post a reminder that lobbying activities are prohibited with NIH funds. You can find guidelines on what those non-allowed uses of NIH funds are on the URL on the screen, which we'll also post to the chat. Your institute or university media offices may also be able to help you understand this distinction. And with that, I will turn it over to Scott.
Thank you, Natalie. Briefly, Heal Connections is a center funded by the NIH HEAL initiative to help accelerate research into action. So if you think of sort of a bridge between researchers and the public, that's the function of Heal Connections. Our mission is, as you see in the slide, both to create pathways to build and sustain relationships between researchers and communities, and also to support you, HEAL researchers, in meaningfully sharing your results. So with that mission, it's very much in the spirit of the sharing session about working with the media to disseminate your research. To assist in this process, Heal Connections is building and extending relationships in 6 different areas of focus. So as you see, we're different stakeholder lanes around community-based organizations, health, patients, priority populations, state, tribal, and local, and federal government, and criminal justice. The framework is intended to accomplish the mission of the last slide, this bidirectional partnership between HEAL research teams and the beneficiaries or stakeholders of that research. And as you look at this little wheel here, it also might occur to you that not only do these different stakeholder lanes potentially want different information, but they also might want it in a different format. So for instance, if you're communicating to healthcare professionals, maybe they're interested in more of a fact sheet. If you're communicating to policymakers, maybe they're going to want a policy brief. Patients might want a YouTube explainer video or something different. And so that's a little bit of the novelty of Heal Connections, is picking the priority populations. What do they want? What format do they want it in? And so one more little plug for this topic, from an academic perspective. I understand early on in my career, I was never imagined or was never taught to work with the media, talk to the media. By and large, I was encouraged to publish like crazy in academic journals. And so my mentor gave me advice to publish like crazy, both to justify to my colleagues that I was doing good quality work. It's going to help me with promotion and tenure. It's going to help me write the next grant. And so I've been in this maybe 20 years or so. So if I look at a 20-year history of my publications, my best publication has been cited by others 570 times, which seems, I don't know whether that's good or bad, but it seems like a respectable number. If I total up the entirety of publications over my entire 20-year career, we're clocking around 7,300 citations by others. So again, if you work hard over 20 years, maybe you'll have a record like this of 7,300 people who paid attention, other academics paid attention enough to cite your research. But so it makes me feel good on the one hand, but on the other hand, when I compare it to something like the daily readership of the Dallas Morning News, There you go. That's my local regional newspaper that has a subscriber base of around 250,000 people. It makes my 20-year contribution seem awful puny, just related to the people who might potentially see a news article in, let's say a week of the Dallas Morning News. And heavens, if you're talking about something like the New York Times has something like 10 million subscribers. So that's just a little plug for maybe reimagining our role as communicators outside of what you would be traditionally think of as the space of academic communication to a more broad public space like working with media. So with that little plug, I'd like to introduce our first speaker, Carl Bates. Carl is the Executive Director of Research and Communications at Duke University.
Thank you, Scott. I appreciate that. And folks, Scott has already made my first point for me, which is if you take the time to speak to a reporter and your findings and the public health advice that you have appear in the mass media, you reach hundreds of thousands of people in about a half hour of time on your part. That is the best return any academic ever got for their time, right? Think about the time that goes into that publication that got cited 540 times. You did the preliminary experiments, you wrote the grant, you got the funding, you did the experiments, you did the analysis, you write the paper, you get it reviewed. It's probably like 2-3 years of time for the 540 citations, whereas talking to a reporter, you can really literally reach hundreds of thousands of people. Do you get 10 million eyeballs when you do the New York Times? No, of course not. But even if 1 out of 40 readers looks at that piece, 250,000 people have seen your message. That is the best return on investment you can get anywhere in communications as an academic, that is. Okay, so there's sort of, my job, by the way, is I'm the top science writer at Duke University. I handle our research findings going out to the world, the very thing I'm just talking about, where somebody publishes a paper in Current Biology and maybe a few hundred people will see that, but we get it into the trilobites section in New York Times and millions of people see it. Great. So there's kind of 3 ways to get out there and to be seen. One is making news, having a paper or finding, public health recommendation that is something that you want to share with the public. One is providing commentary, that is writing a piece for something like the op-ed page of your local paper or the conversation website or anywhere that takes commentary, Salon, all those places. And then the third is to get out there in the grubby, yucky world of social media and actually engage. And my poster child here is Dr. Eric Topol, who began life as a cardiologist, and now he's sort of America's doctor because of his willingness to participate on social media, to take media interviews with TV stations. He's pushing his book, yes, always, but there's this interactive synergy that goes with being a public figure in your healthcare field that is additive. The more press you do, the more press you get. All 3 of these paths should go through the professional communicators where you work. If you are an academic medical center or any kind of university taking research money, there are people like me embedded in your organization, and our job is to work with faculty and scholars about their work and get that out to the public in a form that the public can understand and easily digest. So we won't do your social media for you, but we certainly can tell you the tips and traps and best practices to get you started if you want to take that route. We certainly will help you with commentary, including getting them placed. At my school, we actually help you get them placed. And for sure, we'll help you with making news, but we're only as good as the information we receive. You have to tell us what you're up to. You have to reach out to us with lead time to help us do our thing. Here's the thing, the findings that you think have the greatest import, they're in Nature, you're a super endowed senior professor, this is the highest impact factor journal in your subfield. None of that actually matters. What matters is it a story that the public can understand and latch onto? And it's our job as your media relations people to understand that difference. Sometimes it's the side project that the postdoc did with the undergrad is a fantastic story. It's got hooks all over it and the media will love it. And yeah, the great big, I spent 20 years on this thing and it's going into Cell, may or may not make the cut. I'm sorry, I hate to break it to you, but news judgment is different than scientific import. So trust us to help you sort that out and err on the side of telling us lots of stuff. We're filter feeders. You won't overwhelm us by telling us what you're up to. your homework here from my session here is to try to find the communicator in your unit. Try to figure out, in the case of Duke Medicine here, there's actually a communicator in each different division of medicine and each different major subdivision of the School of Medicine, that there are communicators all over the place. Find that person, chat them up, take them out for a cup of coffee, find out what they're working on, find out how you can work with them, find out how they can help you. We're here, we're free, and our job is to help you communicate with the rest of the world. Couldn't be easier. But as I mentioned, timing is everything. The bane of our existence is, hey, Carl, we were on the cover of Nature 2 weeks ago. That is what I call the box of Harry strawberries. Nobody wants it. It's old stuff. It's not going to go anywhere. So we encourage you, well, first of all, we encourage you to think about public attention for your work because it's good for your career. And secondly, to be thinking ahead. So for me, the best trigger is when you get that acceptance email from the journal. Congratulations, professor. Your paper's been accepted. We don't even have a publication date yet, but here's all the stuff about embargo and blah, 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 blah. Forward that to your press officer with a copy of the paper. Doesn't have to be the final proof version. We're going to sort out all the details anyway. And maybe a paragraph or two on what it's about, because in my case, I read papers from every field and I'm not an expert in any of them. I'm a political science major, thank you. So just a sentence or two about why you're jazzed about this and why you think this thing is cool. Are you giving a big talk at the cardiology meeting? We need to know about that a month ahead. Tell us now so that we have a couple weeks to do our thing. And I like the trigger of acceptance because most journals now are operating in about a 3-week time frame, give or take. The open access ones just do it whenever, but that gives us a couple weeks to come and talk to you and do everything we need to do to make it into a good story for the public. So what do we do? Okay, you've sent me the latest version of the paper. You sent me a paragraph on what it's about. You've maybe told me, hey, we got stop action videos, or we got a time lapse of this, that, or the other thing, or we've got this awesome graphic that we did for patient education. Give me all that stuff. I'm going to look it over. I'm going to figure out whether this is something we feel the public would be excited about or not. And the public also includes journalists, right? The first hurdle is to get the journalist excited, and then they tell everybody else. So give me all that stuff, and we'll look it over. If it's a yes, then the process is I read the paper very closely. I come up with a bunch of questions. Being a former journalist, this is what I do. And then I'll come and interview you, or we'll do it on Zoom, or even do it on the phone if you're at the beach, whatever. I then write the story up as if I were a journalist. I write it up as a press release and I assemble the visuals and we put the whole thing together. And the difference here is that I work for you. I work for your university. We're on the same team. You are in complete control of this product, and you're going to review everything I write. You're going to make sure the quotes sound like you want them to sound. You're going to make sure the numbers are right, that we've done the right, and we've highlighted the right parts of it, et cetera, and you're happy with it. Then we distribute your story and I manage the outreach. Most often it's people asking for a copy of the paper, which you've already given me, so we don't have to worry about the paywall at the journal. We handle requests for bigger versions of the image, all that stuff. More and more, unfortunately, the media are not reaching out to actually do interviews. They're frankly rewriting our press release, which is kind of a hellscape from a journalistic standpoint, but it would have been a PR guy's fever dream 20 years ago. The press release frames your story. There's a ton of nuance, there's a ton of detail, there's a ton of jargon in that raw academic paper that you're producing. You can't just put it in front of a reporter and expect them to get it right unless they're a PhD in your field, which is rare, but it does happen. The press release is your rehearsal for what are the 3 things we want everybody to know about this? How are we going to describe that in everyday language? And your press officer will actually put you through your paces basically and rehearse you so that you're ready for the interviews. And then, as I mentioned, this press release pretty much sets the course for everything that follows. Most reporters anymore are not reading the paper, they're reading the press release. So we've told them what the 3 important things are. We've told them what the analogy is. We've given them what's the incidence of this condition, et cetera, et cetera. We've given them everything they need to make their own story. And they may call other experts. If they're good, they do read the paper. But the point is, if you've taken the time to do a press release with us, everything that follows is under your control, more control than it would be than if you just put the paper out there and wished for the best. Okay, so we've done all of that. Oh my God, here come the emails, here come the calls. I wasn't thinking, Carl said this is going to be easy. This is scary. I can't do this. Not to worry, we've got this. Here's what you're going to do. You're going to have a plan, first of all, based in part on what we've worked on in your press release. What are the things we want everybody to know? Very first action item is to respond immediately. Academics are notorious for responding to emails a month later. That doesn't work in the news world. They operate on minutes and hours. So the first thing to do is to respond immediately, but you do not have to do the interview right then. You just have to say, yep, I'm here. I'd love to talk to you. Can we talk at 2 o'clock today? You can even tell a little white lie if you need to. But the first most important thing is to respond immediately so they know, yeah, that person at Tulane wants to talk to me. Great. I don't have to keep searching. If they don't get a response, they keep looking until they get the expert that they want, and your opportunity is past you. So respond immediately, schedule a time. Now, hang up the phone or close the email. Now do your homework. Who is this person? What do they write for? Call the news office, email the news office. Hey, have you ever heard of this outlet? Have you ever heard of this? There are some kind of skeezy right-wing news sites out there that we avoid. We actually have a blacklist of some sites that you shouldn't do business with. Reach out to us and find out, do your due diligence and find out who this person is, what the outlet is, whether this is somebody you want to do business with. You do not have to do the interview ever. We want you to, we encourage you to, but it's also okay to say no. All right, now you're going to prepare yourself and the space you're in. It's a Zoom interview. Take a look around and make sure there's nothing embarrassing behind you, like this poor schlub who's on BBC with an unmade bed behind him and an open cabinet. Like, dude, you know, everybody has seen the famous BBC, you know, where the kid comes into the room while the guy's talking. We all found it adorable. He was horrified. Just be prepared. Have your space right and make sure you're not doing anything embarrassing. You have to control the sound. So get away from the white noise of the lab or get away from the hallway where people are always yelling at each other. And, you know, be in a place where you can control the sound and the light so that you look and sound good. People judge your competence by how clean your signal is, believe it or not. So even a scratchy microphone can hurt you no matter how brilliant you are. So what do they need? They need a responsive expert, that person who responds right away and says, yeah, I'll talk to you at 3 o'clock. I'm out of class then. And a good quote. They're not looking for your 50-minute stump speech on this topic. Quite the contrary. They want the highlights. They want you to cut to the chase. A good quote is something that is accessible in language, clean in structure, and short. So it doesn't have all the dependent clauses and passive voice of academic speak. It's like you talking over the back fence to your neighbor. That's what a good quote is. In the interest of time, we're not going to get too deep into this, but if it is a radio or TV outlet, your very first question is this live or is this taped? It's almost always taped, but a live shot is something to be wary of. You have to be just that much more prepared. The other important distinction between radio and print, or TV and print, is that the electronic media needs you to say this in your own words in a very efficient way. The print media will help you and paraphrase you and pick out the best part of that big long paragraph you gave them. But the electronic folks need you to say it in your own words. So a little bit of practice, a little bit of rehearsal, a little bit of forethought is a great idea. So tools that are going to help. Those visuals that we talked about in your press release, offer those to the reporter. Hey, we've got some data, we've got an infographic, we've got some patient education materials. Be happy to share that with you. Have concrete examples. In scientific communication, you know, we're told to stay away from storytelling, told to stay away from anecdote, use the aggregate data, keep it as objective as you can, but that actually doesn't work well with non-scientists. They need an example. So you can create an imaginary example based on sort of the median of all the data. Here's what one patient's experience would be like, because we relate so much better to that than we do to the aggregate data. That's the way humans are. A few numbers, not a ton of numbers, but a couple of really powerful numbers that you've got lined up in advance. And you literally can have a Post-it note next to you. There it is, Post-it note next to you that's got your key numbers, the metaphor you want to use, the name of the patient you were going to mention. Just have a little crib sheet handy so that you make sure you hit all your bases. Television very often will then say, well, this is all fine and well, but we need a patient. Again, the human face, the single example is what's going to tell the story, and it's what's going to carry the story. So anticipate this. The TV, especially local TV, especially, is almost always going to want to have a patient. Here's another place to involve your press officers. We do this all the time. We carry HIPAA forms in our back pockets. We will help you through all of that. And do no harm, right? Make sure this patient is somebody who's up for the experience of dealing with this and the visibility that comes with it. They have to have their heart in the right place. They have to be motivated in the proper way. The proper motivation, I would argue, is you're going to help other people. By telling your story, you're going to help other people. And if they're on board with that, then you've got the right person. That's it. We're on to Rose Hoban, my colleague, who's going to echo a lot of what I just said, but from the other side of the transaction. Thank you.
Thank you very much, Carl. We do have some questions, but we'll save those questions till after the presentations are done. And with that, let's hear from the founder and editor of North Carolina Health News, Rose Hoban.
Hi, thanks for having me be part of this whole presentation. So I'm going to jump right in and talk to you about what working with the media. So I'm going to do something here about setting some context. You know, local media has changed dramatically in the past 20 years. You know, your local paper might be gone, or it might be so diminished that getting your message or your name out there might be a challenge. So, you know, you'll have to go looking sometimes for places to get your message out. So the first thing to do, and this is echoing what Carl said, is do a thorough analysis of your news sources. You know, news organizations have experienced basically a bloodbath in recent years. These data only go up to 2020. Last year was a really bad one for journalists. And in case you didn't know it, journalism's in a crisis that has to do with our business model, but that's a whole different presentation. Anyway, why is this important to you? This means that the people who are left doing this work are more rushed. They're less likely to understand what you're talking about at first blush, and they'll be more skeptical of the message you want to get out there. So you have to work harder to get to persuade them to do your story, and then for them to get it right. So, you know, for example, why North Carolina Health News, right? I think this is a really good example. This map shows the number of people who were thinking about healthcare, who were assigned to be covering healthcare in North Carolina around 20, 25 years ago. And the blue dots, you know, were people who were full-time thinking about healthcare. And what's happened since is that all of those people have gone away. They've been given buyouts, they've retired, they've been fired, they've been laid off. And so really, like, for a few years there, my publication was the only publication in a state with 10.5 million people writing about healthcare that had anyone who knew anything about it. Getting into the nuts and bolts here. How do you get the attention of a reporter and their public? First thing is you need a good story, something that's compelling, right? People are busy. I remember my very first journalism professor telling me that, you know, you're talking to soccer moms. They're running from picking up kids to sitting there, you know, and they're reading stuff on their phones. So people are really busy. So they need to care. So think about, what is it about your work that's essential to the public? Like, I'm really glad you got published in Nature, but that's not enough. You need to have a story that people are going to care about. And I'm sure that it drives all of the press officers like Carl crazy when they send me a great press release about someone who identified like a genetic marker for a certain type of cancer that affects, 15% of patients. But that story is a no. But if somebody sends me, if Carl sends me a press release about how the water you're drinking is going to make you sick, that's a story I'm going to do. So that goes into, tell me why I should care. One of my very first editors told me that people only care about a story if it goes into their mouths or something's coming out of their pockets. So, for example, I'm going to reference this later. There's a drug treatment program here in Raleigh. And one of the things that they do is they query all of their graduates about how much they paid the prior year in local, state, and federal taxes. And then when they collate their answers and they go to policymakers, they're able to say, oh, hey, this is what the cost is and this is the benefit, right? So, it's this organization is called Healing Transitions. And, you're not looking for donations, right? But you need data that shows the worth of your work. And, once you've got that data, and sometimes it might mean querying your subjects, but you've got that data and you're going to use this to help your audience, to help make the audience care about your work. It's not enough that it was done. It's got to be relevant to the lives of the people in the audience. And just in case anyone's ever interested, this is all documentation on how program evaluation and calculating your return on investment is really valuable, particularly in public health interventions. So back to the nuts and bolts. If you are, again, echoing Carl, if you're interested in getting your story out there, you need to give people some notice. Don't send me or the reporter you want to talk to notice of the event the morning of or like the day before, right? We're busy too. As I said, we've got fewer reporters covering the same amount of stuff. So people are kind of running around a lot. If you want to fit into the schedule, you need to give some notice, and embargoes are great. And I will say, most reporters know how to abide by them. In addition to audiences being short of time, reporters are too, right? The other thing is, as Carl said, don't make us wait. If you're calling and especially with TV, I hear from my friends in the TV world that they have editors breathing down their necks. And one of my reporters has a husband who works at the largest TV station in the Southeast. And she describes their workday as them being like chickens running around. They have holes to fill every evening. And so sometimes they have holes throughout the day, a news hole, like a space where they have to have a story. And so the content, remember, has to be relevant. And if someone calls and asks for a comment, don't wait a day or 3 days or a week, because like Carl said, your opportunity is going to be gone. It'll have completely disappeared into the rearview mirror. The other thing is, please, please, please have somebody there on the date. So your press release goes out on Friday the 19th or whenever your embargo breaks, and the paper is published on that day. Please make sure there's somebody at the other end of the phone, especially if you've had an embargo. It's like, you're embargoed. And then you have reporters who are like, oh my gosh, look, here's this thing. It's really cool. And then they're sending emails to someone who's sending back and auto-responding with an out-of-office message that you're gone for 2 weeks. That's a really good way to make reporters angry. And I guarantee you, they are not going to call you the next time. And as Carl said, please have someone that I can talk to, a real person, right? Having that face that goes with the story is really what makes the story work, right? You're trying to get something across. You're trying to, you're trying to get this out there. You're trying to help people care, and people relate to other people. They don't relate to data. So this might mean that as you're doing data collection or you're working with your subjects, that in your release, you will say, if we were to be called about a story, would you be willing to give permission to share your contact information? Or as you're approaching your publication or your release date, reach out to some of your subjects. Now, I know it's hard if you're blinded to your subjects, but it's useful if when the time comes to do the story that you have someone to illustrate the things that you're trying to get across. This is why Biden and every president has people sitting up in the gallery, right, that he can point to and say, Rose Hoban, she's up there. This happened to her. Really important. That's why this happens. This is a great example of how well this happened. This was a story in the New York Times about a study that was done out of NIH, and they were looking at long COVID and ME/CFS patients. And they had this woman, and she was ready. She was willing to be interviewed, and she put a face onto this complicated research and it helped people relate to it. And, having photos of her all through the story made slogging through the technical data much more compelling, because you were interested and invested in how this patient had done and what was her journey, what was her healthcare journey. The other thing, something else, we're giving you a lot of things to do, so I'm sorry, but this is the reality. One of the things you have to do is to speak English. You need to examine your talking points for acronyms and jargon and ruthlessly eliminate them. Also, please try and speak in full sentences, especially if you're talking to broadcast people. It's really helpful if you repeat the question as you answer. Something like, the reason HIV medications are vitally important is, or my work on the sex life of frogs tells us a story about the environment that blah, blah, blah. So, and don't get too caught up in grammar, just sound like yourself. Even as you're doing that, try and craft a message that's clear and simple. I joke that you should think of reporters and maybe think of your audiences like baby birds, but really reporters, because they're the ones who need to translate it. The messages have to be broken down to make them super simple and understandable. You might be the kind of person who runs to the web or to a reference to check what you read, but most folks don't have the time. So really, like, give people, like, explain technical terms, explain what you're trying to do. And, also, if you've broken things down really clearly, you can also entice more people to pay attention. The research shows that about half of people just don't follow the news at all. And so what could entice a reader or a listener or a viewer to actually pay attention? It's a good idea not to have too much information. And Carl mentioned this. I always tell researchers that I'm going to talk to have 3 bullet points and really no more. Maybe 5 at most. But here's why. A lot of reporters, in addition to being rushed, they don't have a lot of space, right? Like in terms of the number of words to relate all of your talking points. So it's up to you to give them your priorities and then really boil them down and commit them to memory. And when I say commit them to memory, I mean commit them to memory. You should be able to recite them in your sleep. And when I say in your sleep, I mean in your sleep. This is a picture of me after I had to have abdominal surgery a few years ago. And the joke in the household was that I was laying there, and I'm a nurse by training. And the nurse comes in, and I'm still sedated. And she says to me, "Oh, I hear you're a nurse." And I said, "Yeah." And she says, "Oh, where do you work?" I said, "I'm not practicing." And, "What do you do now?" "I run North Carolina Health News." "What's that?" "News, trends, policy, everything you need to know. We're at www.northcarolinahealthnews.all. You need to spell it out." I was able to do it in my sleep. And my husband sat there and he laughed the entire time. So when I say in your sleep, in your sleep. And the way you do this is by practicing. This is from a little video of Obama practicing a speech about the Affordable Care Act. He had to practice. You're going to have to practice. That means talk to the mirror, talk to your spouse, talk to the dog, talk to your kids if they'll put up with it, talk to your staff and your coworkers, but practice, practice, practice. And during an interview, remember, if you've prepared, you've made your 3 bullet points, you've practiced, and you know it in your sleep, it's going to be easy. I promise you. So like I said, you should know it in your sleep. And we're going to see if we can actually get this quote to play. Okay. Well, this was of a lovely, lovely man who was a researcher who really struggled to come up with a good quote. And you don't want to sound like it. You want to have your quotes ready to go. So negotiating terms. So here's something. Off the record, let's talk about some of these terms with reporters. Off the record. It's great to formulate your thoughts in a non-quoting environment, but at some point you need to go on the record, or else you won't get called again. We want people that we can quote on the record, right? So there's a level of negotiation that goes on between you and the reporter to come to an agreement about how you'll be quoted before you start, right? So first thing is off the record. You can ask, you want to do this before you start. You want to say, like, can we talk off the record for a little bit before I go on the record? I just want to explain things. And most reporters are going to be totally fine with that. Actually, all reporters are going to be totally fine with that. They'll say, "Will you go on the record?" And you'll say, "Oh, yeah, I'm going to go on the record. I just want to clarify my thoughts before I give you a quote." And people will be fine with that. So you may ask a reporter if you can see the story before it publishes and edit it. And the answer is going to be no. reporters will not let you read the story before it's published. And, why is that? Like, we don't give the governor or we don't give politicians the ability to review stories before they're published. So these are global policies, right? What you can ask is for review of your quotes for accuracy. It's very frustrating when you call somebody up and you say, hey, just want to go over your quotes with you. And then you start editing. Well, let's change this word here and that word here. No, I'm just making sure that I'm quoting you correctly and accurately. If you start doing too much of that, like, oh, let's try and shoehorn in another phrase here, you're going to end up sounding like a press release. And we want you to sound like you. Okay. So have your talking points ready, have your practice so you don't fumble. And then, remember that it's easy, it's pretty easy to edit. If you have images, have them handy and ready to send along to the reporter. So if it's a chart or an analysis or a graph like this, make sure the titles are really clear and explain what the viewer is seeing. That way, you can put that in the caption. That way people won't just sort of look at it and go like, what the heck, right? You should also include your name on the graphic, and better yet, like also the URL of the study as it's being published. But keep in mind, most of the reporters that you're going to encounter are not scientists, and a lot of them hate math or they're intimidated by math. So keep things simple and understandable. Like, this is something that more people can relate to. And I really like this particular slide because it's got all of the things that I was mentioning. It's got the attribution, right? It's got the researchers at the top. What was the study? Where can they find it? And then at the bottom, in the caption, it's, that all the responses of COVID-19 vaccine uptake status, right? Like, so this is a very self-contained graphic. This is a great graphic, and it's a pie chart. Most people, like 99% of the audience, is going to understand a pie chart. Have it be nice and simple. I love this graphic too. Really clear, understandable, self-explanatory. Maybe I wouldn't say putative source of SARS. I might say probable or suspected source of SARS, animal to animal, and you go on from there, right? Like, but just have it be super clear so that people who are coming at this, who don't have all of the knowledge and education that you have, are going to be able to absorb this graphic. It's also useful to know your outlet. Are you going to be talking to someone from a small online publication, a big paper like the Times, a small targeted, maybe a trade publication? Take a look at the publication when the reporter calls you. Take a look at the publication and see what stories have been done and what elements they've used, right? And what stories work for you, right? And then pitch your story accordingly. Do you need photos? Are they going to need video? What kinds of voices? It's really useful to kind of know what these outlets are looking for. The other thing is that don't be afraid. Like, if like Carl works at Duke, I'm here in the Research Triangle. There are a number of researchers who over the years have given me a call, and some of them we've had coffee. Sometimes we just have a conversation, but you can invite people to who are reporters to have coffee. It'd be nice to do it near them. Don't make them come to you. We don't bite. We're not always scientists. And the other thing is, when you're sitting down and talking to one of these folks, a reporter, like, we're not going to come at you, and it's not going to be antagonistic in any way, right? You're not a politician, you're not a criminal. Most of these interviews really are going to be getting to know you. Sometimes it's because the reporter is curious about your research or has a curious audience. But get to know the reporter before your interview. Barring that, Google my name. Do some research on who you're talking to. If you like their work on other stories, you'll likely like their work on yours too, okay? So, and if you have butterflies, you'll be more relaxed during the interview if you've done some of this work ahead of time and you've gotten to know someone. So it's just good to get to know reporters and editors before you have to, before you have to. So just get to know them, allow them to get to know you, and it'll serve you later. So, and that's my last slide.
Thank you very much, Rose. Appreciate that. And so we're about to transition to our last speaker, and then we'll get to questions. We will, right before the Q&A, we'll go ahead and play those audio clips that we skipped for Rose. So
That'd be awesome. Thank you.
And so as our last speaker, let me introduce Kate Nicholson from the National Pain Advocacy Center.
Hi, everyone. It's a pleasure to be here today. As mentioned earlier, I am a person with lived experience of pain. And the National Pain Advocacy Center is a Heal Connections National Association partner. So I'm going to be talking today from the point of view of someone who gets the cold call from the media. What do you do? And when I get those calls, I tend to wear one of two hats. Either I am the human story. I am talking about my experience, or I am placing someone from our Community Leadership Council of people with lived experience into a media story in discussion with a reporter. The human point that Rose talked about is a really important one, and we spend a fair amount of time translating why your research is important through our stories. The other thing that I tend to do is either speak about our work as an organization or about pain in general. So for example, last week, Alyssa Court did a piece in Time magazine about the relentless costs associated with chronic illnesses, and I was quoted in that piece. But I've also been asked to comment on NIH research that's made its way into the media. So for example, last year, there was a study that got a lot of attention in the pain space. It involved artificial intelligence and deep brain stimulation and patient self-reporting about their pain. And it found that patient self-reporting tracked pretty well with the more objective evidence. And this was important to people with pain because people with pain are often dismissed or disbelieved when they tell their stories. And many people are subjected to bias in the healthcare system based on their identities. So I was basically asked to say, why is this research important to people living with pain? And as I mentioned, we are a national organization, so the kind of media engagement that I tend to have is with the big national publications like the New York Times or the Washington Post, or with healthcare publications like Scientific American or STAT or MedPage Today. So I'm going to just give you some tips for interviews based on my experience. The first one, which you've heard already, is how important it is to be responsive. I understand that everyone is very busy, but reporters do work on deadlines. The other thing I want to emphasize, in addition to what's already been said about doing some research about the publication, is it's good to ask when you take that call what the purpose or angle of the story is. Sometimes reporters will want to talk to you for general background information, but often they have points they want to make, and they want to use you to make those points for them. So knowing this in advance will do two things. First, it'll allow you to know whether you really want to take that interview or not, but also it will help you prepare. Which brings me to my next tip, which is knowing the message you want to communicate. So you can tentatively prepare responses and quotes in advance. As mentioned, they need to be pithy, efficient. There needs to be no jargon. They need to be explanations that your spouse, if your spouse is not an expert, or your older children can understand. Because reporters have something they want to communicate, but there's a reason you're taking this interview, because you have something you want to say as well. And a corollary to that point, which I didn't put in the slide because it just came up in a presentation I did last week at the USASP meeting, is that you can sometimes even respond to questions via email with a reporter. One of our members, who's a researcher, Juan Hincapi Castillo, was talking about an experience he had working with the media when he had done some studies about opioids. And he was really, it was one of his first interviews. He was really nervous that he might be misquoted or mischaracterized because it was a fairly fraught space. And so he asked if he could provide written responses via email, and was able to do that. And maybe when we get to the Q&A, Rose and Carl can chime in to say what they think of that approach. The next tip is to answer the questions you can answer. It is fine not to have an answer. It is fine to say that you need to get back to someone about a question that they asked. The next tip is to be prepared to pivot back to your point. You can use sentences like, that's a great question, but what's really important to understand is, and make your point. Or that question makes me think of a related one that's really critical, and make your point that way. Again, make your point and make it more than once. Reporters are like everyone else. They need to hear things. And they need to hear it more than once. And often, even if you haven't gotten your message across, reporters will end their interview by asking if there's anything they're missing. Use that opportunity to make sure that you've gotten your message across. You can also offer to send citations that back up your points. Reporters really often need basic citations that show things like how many people are affected by the research you're doing or by the condition you're researching. You can send sites from authorities that you respect, and they'll often be the jump sites that are in the article that appears because everyone's busy, and it's useful for reporters to have that information. Another point I have is to keep the conversation tight and controlled. Sometimes my worst interviews are with members of the press I've become friendly with. So I relax and yammer on a little bit, and then what I see in writing I don't like nearly as well. Final tips, it's really important to use person-centered, person-first, non-stigmatizing language. So you're talking about someone living with pain or a person with lived experience of addiction. The other point is that you may ask to check direct quotes, but as Rose mentioned, you're not likely going to be able to check for or change much of anything else. And I'd also make a point about the off the record, on the record conversation. You need to be a little bit cautious about speaking off the record because occasionally, everyone's human, things that you consider off the record will make their way onto the page. And finally, it's really important to be informative and responsive in terms of building relationships. If you do that, reporters will return to you again and again, and you can be a resource. You can refer reporters to other people, whether that's people with lived experience, but also other scientific experts or researchers. I spend a fair amount of time doing just that. So I want to switch gears for just a minute because, as I mentioned, NPAC is a community partner in Heal Connections. So I want to talk a little bit about why it's important to translate this information and research back to the community, back to the generalists and the people you are serving. We need to be more than just the human story or the human face that gets your point across. It's really important to translate back to people you're researching about. There are studies that show that that kind of translation can change behavior just by itself. There is a rallying call I often like to use when talking about community partnerships. That was the rallying call of the disability rights movement internationally in the 1990s. It is the phrase, "Nothing about us without us." And it basically stands for the idea that policies and research shouldn't be undertaken without input from those who are likely to be most deeply affected by the outcomes of the policy and research. And that is something that Heal has really embraced in terms of having people with lived experience as partners in every aspect of research, which is terrific. But it's also important to close the loop. It's important to communicate back to the communities you serve. And this is a key mission, obviously, of Heal Connections. So I cannot emphasize enough why it's important to engage with the generalists among us. It's important to get your research to the media for community groups, for people with lived experience of pain, those associated with groups and those who are not, who can read your stories and see their own experiences reflected back to them in the news. As I mentioned, it's also impactful for people with the conditions you're researching to get research translated back to them. It's also really important in terms of dealing with policymakers, which community groups like us sometimes do, because many of the policies that we work to change at MPAC are not evidence-based. Their policymaking is often reactive, not responsive. And if you make yourself a resource, if we can show policymakers, what's important, what the context is, and why the context matters, it's much more likely that stakeholder engaged policymaking like that will be effective. And finally, we often use media clips to underscore our points with the community and with policymakers. A couple of resources. First of all, if you liked this training today, I just want to do a little ad for the Mayday Pain and Society Fellowship, which is a fellowship program that I did. But it's mostly designed for scientists and clinicians, and they really work with people about translational knowledge, with working with the media, with writing commentary, with being a resource for policymakers. And I also wanted to just flag this resource for person-centered language, and that is www.changingthenarrative.news, which contains a lot of great points for people who are reporting on pain and or addiction.
Thank you so much, Kate. And thank you to Scott, Carl, and Rose for all of the information you shared in your presentations. You offered some really great tips that I think will be useful to all of us wherever we are in this particular project. So now we're going to move on to Q&A, and I know we have some discussion and some questions already happening over there, so I really appreciate that. But if you do have additional questions, please drop them in the chat and we will address them. But as Heather said, we were able to get the sound working for the soundbite. So Heather and Rose, do you want to, Rose, do you want to set us up?
I'll set you up. So the first quote is from someone I called up, and I was trying to get him to give me a quote about his research, and this who spent years doing this, right? So
complementary mechanisms that we have in mind are monitoring existing. Sorry.
That's okay. Don't worry. Just keep going. I can edit you digitally.
Okay. So we think that enough is spent on the current, complementary mechanisms include mining existing insurance data. There's some great insurance data out there. Large data sets are being developed, and we have access to these. And
finish your thought.
Yeah.
There's great insurance data out there.
Yes. So
you can see I was working with him and he was trying, but he was struggling. Okay, so next one. This is the ultimate quote from this guy. This was awesome. So go ahead.
We see them for one of three major issues. One, they're too sleepy during the day, or two, they're not sleeping at night, or the third, they're having wild or unusual events in the middle of the night.
That's a full quote that I can just put straight into my story, right?
That was great. Thank you for sharing that. I empathize.
Another plug for working with your press officer. We, unlike a working journalist, we will coach you and give you feedback. Well, I mean, Rose does because she's a good person, but that's part of our job too, is to help you. There isn't a human being I've ever encountered who doesn't say the thing better the third time than they did the first time. So part of what we do is just say again, and get it smoother. everybody self-edits. And by the time Ridley had that idea put together, bang, 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 he could do it. It probably the next time he did it, it would be even 10 words shorter.
He's gotten much better.
Yep.
He's a great
Practice,
guy.
people. Practice,
Yeah,
practice, practice.
practice, practice, practice.
Thank you, Rose. I think that's it for the audio clips. Is that correct?
That's it. There's
Okay.
just the two.
Okay, great. Well, then why don't we go to our first question, or a question, Scott? And I think the first one came in from Malcolm.
Yeah, sure. So let me ask a version of Malcolm's question. This is about if you don't have a big university, you don't have a press office, but how do you, where do you go for guidance?
So let's say you're at a little biotech startup. I don't know Malcolm's backstory, but there's 4 of you, your PhDs. You don't have a budget to have a PR person, but you do probably have a professional association, and or you've got friends in your market who are doing the same kind of work, and just network a little and ask around. Communications, we all think we can do it because we've all been doing it our whole lives. We've all been talking and writing our whole lives, but there are some do's and don'ts that we've touched on today, and it's just a good idea to get a little bit of input from somebody who does this professionally to find out what's my best approach here. How can I do this? If indeed you're one of these little 3-person shops and you don't have the wherewithal and the infrastructure to have a PR person, you do probably have a website, and that's a good place for you to put some explanatory stuff about what you're doing, and run it by your teenage kids to make sure that it makes sense.
And of
go
course,
ahead.
if you're NIH funded, you also have the NIH as a resource.
Indeed.
So next question I wanted to ask, maybe of either Rose or Carl, before getting to the preclinical kind of angle, I just want to ask the general question: what kind of scientific results are newsworthy? Either what makes a good news story, or maybe even like at what point in the scientific process does does some finding become a good story?
I've earlier in my career, I would report, like, say, on a mouse study, right? But so many of them don't come to fruition. And then, you've got people saying, well, you should, because if you think about part of what you're trying to do as a researcher, you're trying to educate the public, right? And you're trying to help them care about this stuff. And, so some of the preclinical stuff, some of the more basic science, it's really going to be harder to get folks to care. You might want to think about like a Venn diagram where you start with the folks who really care. So like you're going to be pitching a story more to something like Stat, right? Which is more like a trade publication. It's, only about healthcare. And then as your research kind of like gets closer to, yes, we feel more confident about this, or this has like this kind of implication, then you go looking for like a more general publication to pitch this to. So not to say that preclinical stuff isn't going to, is never going to get written about, but it might be written about by different people, than when you've got like a pill that's going to do something, right?
Carl, do you want to elaborate any on that?
Sure.
Thinking about the preclinical side, people may say, great, so you have a medication that's going to cure my pain. Actually, it's not a medication yet, it's just a molecule.
Exactly.
Or it's in a rat, but it's not in a human.
And I will be getting emails from those patients for the next 10 years when I do that story.
Right.
So what makes it news? Nobody's ever written this down anywhere. It's kind of a dark art that we know it when you see it, but it's an unexpected finding. It's a new angle on something we thought we understood. It came from a really spectacularly cool methodology. There's a bunch of stuff that makes it noticeable, novel. I mean, news is novel is new in scientific talk, right? That's what we say. It's a novel finding. That makes it news. But we kind of, your press officer kind of knows it when they see it. And again, there are a lot of things that are scientifically super rigorous, super important, really going to make a difference in the world that we just know are non-starters for news stories. The guy who won our first Nobel Prize, we wouldn't have covered him for the first 20 years of his career because it was too down in the weeds.
Mm-hmm.
But now I can say a third to a half of all drugs are based on his finding. Now I got a hook.
Mm-hmm.
Thank you, Carl. I have a question that came in, and it's, does the panel have any tips for creating a social media presence and any tips for what we should post or what our post should look like?
I have a researcher who has a lovely rule of thumb, and it's that if she can't say something nice and positive, she doesn't post.
Mm-hmm.
That's a really, really good starting point because it is so ugly out there. I mean, the whole world has become the letters to the editor page of your local newspaper, and people just go at it so hard. But
but people were never that rude on letters to the editors.
Yeah, true. But are you creating value? Are you telling people something they didn't have otherwise? Are you adding your expertise to something where clearly it's needed? Are you saying something positive? Those are all sort of simple guidelines. And there's two audiences in social media. One is the narrow casting of you're talking to your peers about that particular thing that you guys do. Social media is brilliant for that. You get to see the paper the minute it drops in preprint. You get to hear that so-and-so just got a new job at Dana-Farber. All that's wonderful, but you're also publishing it for the entire planet. So that's broadcast. And you just have to be mindful of both. And you'll do better if you're responsive. You'll do better if you're participating with other people's threads, but it can be a huge time suck too.
Yeah, it can be a ginormous time suck. And, kind of to reiterate what Carl was saying, like, I say to my reporters, like, don't put anything on social media that you wouldn't want your grandma to see. Right. And be very cautious. And then the other thing is just ignore the trolls. Like, don't respond to them. And they're saying, you're a hack. And you like, don't give in to the temptation. Like, I had somebody this morning, I had someone who wrote with an email to our editor, and I gave a very sort of thoughtful response, right? And this person came back and said, well, the legislature, you just do the work that this lawmaker wants you to do. And I was just like I tried to be, and it's like that out there. People, there's a lot of free floating anxiety out there. Like, just don't if you're a hair trigger person, just stay off of social media.
So let me take the next.
I would also say that because you are broadcasting it to a large group of people and not resources, sometimes not just other scientists and researchers, sometimes you're going to get engagement from patients, and you've got to be really intentional, one, about whether you want to engage, and two, about how you engage. And there are a lot of people with great need out there who will want to talk to you incessantly about their concerns. Again, being human and sympathetic is important, but so is being really intentional.
And having very set limits, right?
Right, and boundaries. Yeah.
Boundaries, really good boundaries. I'm an RN, and people hear that, and then they're like, well, I've been to 6 doctors. Can you tell me about this? And I'll say, no, I can't. No, it's really outside of my expertise. I'm so sorry that you're having to go through this, but that's just beyond what I'm able to do. Right. And there's a level of humility that you have to really have in great supply in order to get involved in social media.
Let me give Kate the next question as well. And so it's coming off of one of Carl's points about do no harm. And so I had a particular experience where we discovered that a lot of places in town were selling Delta 8 THC. So it's not Delta 9, it's Delta 8. It's the stuff you can buy in a gas station, basically. It's a workaround. And we were afraid if we did a big press release around this, you'd have every kid rush to their nearest gas station and stock up on all this, quasi-legal substance. So that's my experience in substance use. And I wonder if you could talk about, things that researchers should be mindful of when sharing their findings, or, so what do you think?
Yeah, I mean, I think first of all, I think about this a lot in terms of being the human story or giving sort of a patient interviewer to a researcher to be that. You've got to, we train people in how to speak with the media. I think that's really important. The same thing that Rose said about putting something on Twitter, we want people to be okay with their mother hearing what they said or their employer hearing what they said. But there are also a lot of things that reporters will ask that can be harmful for an individual. Like I had a situation where a photographer went in and wanted to take a close-up shot of a prescription pill bottle that had, for a controlled substance, that had someone's address on it and someone's dose on it. And I had to say, thankfully they called me and I had to say, no, that's not okay. That could do harm, So I think you have to be, and reporters are curious, if they want to take a shot further away of someone going through their pills so that they can show that there are a lot of medications involved, that may be perfectly fine. But I think it's important, to know, first of all, that often you're dealing with someone who is vulnerable in this situation. They're probably wanting to tell a story because they do want to help other people. But I do think that the researchers who are involved also have a responsibility to do no harm and be attentive and be available if there are questions like that come up, if they're the individual that's placed that person in the story or with the reporter.
And how about, a version of that is around stigma and stigmatizing, language and imagery and so forth. Any of you have any thoughts about avoiding those things?
I do. I mean, sorry, I'll just, that's something that I will speak with reporters about just from the get-go, because I have had far too many experiences, and not just talking with reporters, but even writing an op-ed, because when you write something, you don't get to decide the title that goes out. And I remember doing one early on with Ryan Hampton, who is a person who with experience of addiction, and we were sort of talking about two sides of the same pill. And after the reporter got the things, the editor got the things about the stigmatizing language, but the person who put the title on didn't. And so it was like one of us was someone with pain and one of us was an addict, and we had been talking about the whole no, and we got that title removed, but it still went out live, and a lot of people saw it that way, which was exactly the opposite of the point we were making in the piece. So I think it's really important to be super upfront about that, even if you always be gracious, but just let them know this is so important to you because of the work that you do, and that we have to use non-stigmatizing language for every population involved.
And
again,
there is,
they sincerely want to get things right. So
right,
give them the guidance.
at the same time, there's a point at which it becomes nitpicky, right? Like, so, like obviously, like to your point, Kate, like addict over, user or substance user, right? Totally. But like I had a researcher write to me and was like, it would be better if that picture was black and white rather than color, because the bright colors, blah, blah, and and it was after the publication, and I was like, I get your point, like, and he was like, well, it appeals to children. I'm like, and it appeals to readers. Like, I want people to like see this image and like read the story, right? Like, so, it gets to, sometimes it just gets to a point where, like there's diminishing returns.
Thank you. There is another question in the chat. Does the panel have any tips for scientists to find the hook for the American public? So we've got a research story out there. How do you find what's news and how do you share that?
Why should they care?
Yeah. I am early in my career, very early in my career. I was working on the West Coast, and there was somebody who called us. I'm trying not to identify this guy. It was, they did research on water, and he had very kind of like scientific-y, this is why, blah, blah, blah. And, and I kept saying to him, like, so why should readers care? Why should readers care? And this guy has pivoted now, and he has become very good at saying, water pollution, things that people are going to care about, using terminology that people are going to care about. It's in your water, it's in the water of, half the nation's water systems. So finding the hook means really helping people to understand how it's going to affect their lives or the lives of people they care about.
Can I ask you all a little question, a language question that has vexed me? So I'm all aboard person first language, but it can be difficult and clunky to write using it. So to say a person experiencing homelessness with a substance use disorder, it's much easier to say a homeless addict, and really clearer to write that way too. However, a homeless addict is stigmatizing in two different ways. So how do you avoid stigmatizing language but keep the simplicity of the language structure?
That's really challenging. And to Kate's point, headlines are so hard, right? Because especially right now, everyone's thinking about search engine optimization, and like SEO will give you only like 150 characters, right? So just writing things out. So sometimes like you may have to swallow hard on the headline so long as it's not stigmatizing, so it might be like homeless substance users, right? Rather than person experiencing so homeless substance users, blah, blah, blah in the headline. And then in the body of the story, you get to more of the person first language. And again, it's sort of like, it becomes kind of that negotiation and sort of like, is every instance, like a problem, right? And what are the hills you want to die on? I totally get your point, Kate, like homeless addict, right? Like nails on a blackboard. Homeless substance user. Okay, we can do that. And it's only like 8 characters more for SEO. In the body of stories, it's a little easier with that person first language. I mean, I know that we do that all the time. I talk about that all the time with my team. But then also flag people when usage has changed, please. I was on Twitter one day, big mistake. And I've worked really hard at helping people get like people with autism, right? And then there was this whole Twitter thread of people with autism saying, all these stupid reporters using people with autism. We call ourselves autistic. And I was like, well, then let me know that, right? So let me know when the language in your community is changing.
It's not always clear.
Ask the person you're talking to how they like it.
Yeah, that's always useful.
Right. And because oftentimes people will want to not use person first language. That's happening. People want to call themselves disabled, not a person with a disability. But there is a difference between you saying it as a someone who's not a member of that group and the individual themselves. And of course you want to respect how people want to be referred to. But yes, there is a real movement now in a lot of autism is one of the chief areas that was driving this within the disability community. And there are these kinds of changes, but I still think you're better to err on the side of caution using person first language if you're not a member of the group. People can refer to themselves however the heck they want to if they're a member of the group.
And I've gotten to a point where when I am interviewing somebody, I'll say like, what's the best way to refer to this, and hopefully people are doing that more and more, but realizing that language does evolve has been helpful.
Thank you. Damon in the chat had a question. He'd love to hear your thoughts about the newsworthiness of negative findings from clinical research. So oftentimes the great work of research, they have a null finding for the primary hypothesis. Yet those findings are still very important. So how do we address those with reporters, or do we?
So, well, I mean, we were talking about it a little bit, before the webinar when we were all of the speakers, and someone was talking about intermittent fasting. And now we're getting research out there to say that, well, maybe it's not so great. We're also getting more of that research on things like red wine, right? For years, the thing was, oh, red wine, it's okay in moderation. You can have a glass of red wine. And now people are going, hey, no, like any alcohol, it's not okay. So part of it is how widely is that negative finding going to apply?
I was going to say, the reporters are not cued into your experimental design. They don't know what hypotheses you were pursuing. They don't actually care that outcome number one came out null. They just care about those findings that you care about. Like what can we tell the public from this study that you've done? What have you figured out that's going to be useful in their lives? You know, as for chocolate and fasting and red wine, I don't know about you guys, but I hear the public complaining about that seesaw all the time. There's a whole genre of medical writing for clickbait. If I put chocolate is good or chocolate is bad, I get clicks, and I don't actually care. And tomorrow I'll run the other direction. Yeah, those are just junk science, most of them.
All right, let me do a quick time check. We have time for maybe one or two more questions. And so let me give the next one to my friend Alfredo. And Alfredo asks about how do you present research findings about a minority cultural group in a way that engages a broader audience that may not have very few, very many of those people in it.
Yep. I love that one. And Alfredo, that's part of why I put my email in my identifier here in case we didn't get to it. It's the same answer. Why would everybody care about this, assuming that they are good enough humans to give a damn about a demographic that is not their own? And you can do that sometimes economically. You know, the healthcare system spends twice as much on this demographic because fill in the blank. It all comes back. Nobody has to care about that particular subgroup, but you can make them care about it by explaining to them what the broader societal implication of this is. This group has been left behind and it's costing you a ton of money, dude.
It goes back to that, calculate the return on investment thing. Like,
Yep.
What is the societal cost? What is the physical cost? What is the cost to taxpayers of having these many people, exposed to arsenic in their water, right? And so, so sometimes it's not just there's arsenic in the water, and it affects you this way. So
Yeah.
some of it might be going that extra step to get to that so that people understand like why it matters to them. People are really self-interested, right?
Yep.
Mm-hmm. Can I ask you all a question about, how do you know whether it's worth it? Or how do you know like what really the impact is? I sometimes I feel like these press releases that my university does either go nowhere or they're just read like by people like me. And they just don't seem, really worth it in a way. Can you talk about measuring impact and knowing whether people actually read it, engaged with it, using the information?
I mean, you can usually tell pretty quickly, what the numbers are. And I have found that it is worth it, that whoever tells the best story sort of wins the day in terms of impact, in terms of people caring about something, and that shapes, research dollars, that shapes policy, that shapes all kinds of decisions. Getting people to care about an issue really drives behavior. But you can look up, how many times things are cited and the kind of stats that you get pretty easily.
How would you look that up in the popular media? I mean, I know how to do it with an academic journal article, but how would I know a newspaper article or a tweet? How would I know that?
Well, there are services you can subscribe to that some are free that you can check, but there are also, I mean, a lot of publications, I mean, if you're writing commentary, will tell you how many times things have been shared or how many times things have been circulated. So some of that's just right there on the face of the site.
There's a tool called Altmetric, Scott, that is a browser plugin, and it will show you not just how many tweets you got, but it'll show you the tweets, and it'll show you every single article that you got. That's one response. The other response is, man, if I had $1 for every story I thought was great that went nowhere, you know, I would have retired years ago. It's an imperfect art. We don't always know when a story's going to go or not, but it's still out there. And
Mhm.
sometimes we get reporters reaching out for a story that was 3 or 4 years old because it's out there and they found it.
And
I know for
sometimes,
sure that if you don't try, you're
Mhm.
not going to get any good attention.
and
So you got to
sometimes
at least try.
you put a story out there and then all of a sudden someone finds it on social media and they link
Boom.
to it and it just blows up. And you're like, I did that story 6 months ago. You know, why is it getting a hit now? And
Right, but that's also the point that you can share it and your friends can share it and your network can share it, and it may not even matter where it was placed. If even if it was a local news story as opposed to a national one, you may get more eyes on by promoting something that's been published using social media.
But if you don't ever try to put anything out, I guarantee you 0 eyeballs. That answer I know clearly.
Yeah, that's a great point. I once heard a famous movie director said that a movie hit is what happens in the middle of a string of failures. So sometimes I feel that's the way it is for academics too. But it's
well, and someone said that to me recently too. Like, you know, I was talking about a story that blew up for us, and he said to me, "Oh, this is what an overnight sensation looks like." You know, we've been publishing for 12 years, right? And like suddenly everyone's taking notice, right?
It's just a weird bit of luck the way things can line up for you. Sometimes one person picks it up on Reddit and you got 40,000 views. It's just kind of random.
Thank you all for this excellent wisdom. Let me turn it back to Natalie.
Yeah, thank you. I think we could have this conversation continue all afternoon. So I really appreciate everyone who joined us today. And I want to give another thank you to the presenters. In addition to working with your university communication offices for press outreach, researchers funded through the NIH should alert their program officers to any upcoming publications. So please be sure to do that. And for additional capacity building, here are some of the resources recommended by the panelists. We would love your feedback on today's session. Your feedback helps us plan and improve our future sharing session webinars. We'd love to hear what you want us to talk about and what topics are important to you. So please take a few moments to share your thoughts with us. The link is also in the chat. Finally, please stay tuned for post-event emails. We will give you another chance to evaluate our survey. And we will also email you with a recording of today's session along with slides and resources. So thank you again for everyone joining us, and I hope you all have a wonderful weekend.